Welcome to Your Need to Know. I'm your host, Catherine Reed, and joining me today is Ridge Multop, who is from the AARP, and our subject today is Medicare. Thanks so much for being here, Ridge.
Thank you for inviting me, Catherine.
Well, this is a subject that millions of people in this country care about, and I'm sure among them some of our viewers today, because Medicare is something that millions of people rely on for their health care. And yet it seems to be changing all the time. And every once in a while we hear that it's in jeopardy and it may run out of money. So I want you here today to kind of dispel some of those myths and tell us what we should be asking and how we should be approaching Medicare.
Okay, well, let me just start off by giving you a little bit of background about Medicare. Medicare is 53 years old this year. It was signed into law by President Lyndon Johnson in 1965. Why? What was going on? There was a larger number of people who were aging longer than they had in the past. They didn't have insurance, and being older, they couldn't get insurance. So it was on the edge of being a crisis, of a senior's healthcare crisis. So the administration proposed, Congress acted, and they passed and started what we now today call original Medicare. And that is what we call Part A and Part B. In other words, hospitalization, hospital care, and then doctor care, outpatient care.
Okay.
And those two things are still the primary pieces of Medicare. Now, you also had, in the early 2000s, about 15 years ago, there was another situation that was causing concern, and that was the cost of prescription drugs. And so in 2003, Congress passed another law which established a prescription drug benefit as part of Medicare.
And would you say that that is the part that is confusing most people now, since so many older Americans are on maintenance medications of one kind or the other, that the confusion and the costs and how it changes is the biggest hurdle?
Yes, it's not the biggest necessarily, but it is certainly a significant hurdle for a lot of people. Now, so that's Parts A and B, and the prescription drug benefit was Part D. Where is C?
With the mysterious C.
The mysterious Part C. Part C is what are called Medicare Advantage plans. These are plans that are sold by private insurance companies that are basically HMOs, health maintenance organizations, and they coordinate with Parts A and B.
Now, is that voluntary? Is that considered supplemental insurance?
That is voluntary. It is a type of what you might call supplemental insurance. You must buy both A and B before you can sign up for a Part C plan. And the important thing to remember about Medicare Advantage plans, they have monthly premiums, but they only cover specific providers in specific areas. And people sometimes will sign up and then will go to Florida for the winter. And they'll go, oh my gosh, that wasn't covered by my Part C plan. No, you're out of the area.
You're out of network.
You're out of network.
I think people have forgotten HMOs. I mean,
oh yeah,
HMOs, and at one point it seemed like all of us had HMOs, and that's the only thing there was. And that was kind of came and then diminished a bit. So this whole idea of a provider network and having to see people in the provider network, I'm not sure it's in people's orbit still.
Now there's another option for supplemental, and that is what are called Medigap plans. And again, Medigap plans are all run by private insurance companies. Their premiums vary. Their coverage varies quite significantly. So again, this is one of those things. and I'm beginning to talk about choices. Because it turns out, and this is when you were asking about prescription drugs, it turns out that people don't realize how many choices they have to make.
Oh, that reminds me, there's a wonderful book by Barry Schwartz called The Paradox of Choices.
Yes.
Where, if you're familiar with that, I love The Paradox of Choices because it shows that we have decision fatigue. And we have so many choices to make increasingly every day from sunup to sundown that we don't necessarily spread our energy to where we're giving the most energy to the most important decisions. We're kind of giving the same energy to all of them, which means by the time you get down to trying to sort out what your options are on Medicare after you've already made 15 decisions, since you got out of bed, people may not really have a lot of energy to focus on sorting through these things.
Or they didn't realize that they had to make those choices.
Wow.
Because one of the other things that I like to emphasize when I'm speaking to a group is that Medicare is individual insurance. You can't buy it for a couple or for a family. Medicare is for an individual. So each of you has to make your own choices. So if I have made some choices about Medicare for me, you have to make choices for yourself. Now we can coordinate.
And that's very unusual because like
Yes,
right
it
now my
is.
husband and I are
That's
under a plan that covers
exactly right.
both of us. It's the same plan. We're two individuals in the same plan.
My wife and I went through the same thing, exactly the same. So there's that. It's individual. It doesn't offer family coverage.
Right.
If you have grandchildren living with you, you can't buy coverage for them through Medicare. Important thing to remember. And the other thing that people don't realize is that Medicare doesn't cover everything. Yes, it covers inpatient hospital care. It covers doctor visits. It covers tests. It covers preventive care, through Part B, all of those things. But the important thing that it doesn't cover, well, there are several things. The three most common are it doesn't cover vision care, it doesn't cover hearing.
Ooh, that's a big one.
And that's a big one. And it doesn't cover dental care.
Those are all three. As you age,
Yes,
those are the
yes.
three things you
And
have
they're
to
the
do
ones
something about.
They're the ones
Yeah.
you need to look at. Now, the other thing that people need to be understand about what it covers is that Part A will cover skilled nursing care, but it will not cover custodial care.
So there has to be a medical reason.
There has to be a
Not just-
medical
yeah.
reason. Absolutely.
So if you lose mobility and you need
And-
assistance, that is not going to be covered.
And you are in assisted living, not rehab, it's not covered.
Okay.
And that again is another important one that people are surprised by that, and for good reason.
Yeah. So I have an aunt who's 95, and I have
Good
to
for
say,
you. Good for her.
and she's in assisted living, and I have to say it's my cousin who's been handling all this. So I have not bumped up against these things, but I can see now that she must have her hands full in sorting through all of these things, depending
That's right.
on where my aunt is living, and she's in assisted living, not in continuous care. And so, having people come in to help her obviously is not going to be covered.
Right. It is skilled nursing facilities.
Right.
It is not assisted living.
Right.
Skilled nursing facilities are covered.
Right.
Assisted living is not.
That's a
Big
huge distinction.
Difference.
Yeah.
Big difference. Which is why so many people end up having to sell assets, having to get on Medicaid to take care of their nursing home.
Right.
And those are important things for people to remember. Now, one of the things I want to do, just really briefly, is to say who's eligible for Medicare.
I was just about to say that because when you said Medicare and Medicaid, and so what are the eligibilities between those two things?
Medicare, you are automatically eligible for Medicare when you turn 65 if you are a citizen or have been a legal resident of the United States for at least 5 years.
Okay.
And you can sign up when you turn 65. And I have to say, I do recommend that people sign up for Part A, the hospital care, when they turn 65. Because otherwise, there's a window there. There's a 7-month window. You can sign up for Part A and B without any penalty. But if you don't have any other insurance and you don't sign up in that window, you will have to pay a penalty for the rest of your life.
Oh, wow.
Okay? So
yeah.
that's why if you are still working, you sign up for Part A, your hospitalization coordinates with your private insurance. You might sign up for Part B as well, depending on how high the deductibles and copays are. Part B does have a premium, a monthly premium of $134 that you have to pay. If you are still working, they will send you a bill for it. If you are not working or you are getting Social Security, it's automatically deducted each month from your Social Security benefit,
Wow.
$134.
That seems kind of efficient, which surprises me.
Which it is.
It kind of surprised me how efficient that is.
Well, they actually coordinate it. But so we're talking about people over 65. There are currently around 48 million Americans who are covered by Medicare. 48 million.
That's a lot of people.
It's a lot of people. And Medicare, the total cost of Medicare is over $680 billion. So you can see the extent of the insurance that's necessary for older Americans. And that's what it's about.
And they're also living longer.
And they're also living longer, absolutely, absolutely.
Well, it's interesting that, you bring this up about the Medicare and the eligibility based on age. Mm-hmm. And this is all, I have to tell you, is news for me because I'm not eligible yet. But but Medicaid is something else you've also brought up. Right. And I want in the next segment to do a deep dive in how people know when they're eligible, not just for Medicare, but when they might be eligible for Medicaid. Because, again, these are very complicated issues for people who are not subject matter experts. And, I'm kind of concerned about the fact that people don't understand what is involved in making these decisions and what they might be eligible for. So when we return after this break, we are going to be talking with Ridge Multop about Medicare. So please tune in because this is the information that you truly, really need to know.
This is the story of a boy who was very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help, and slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
What do you think you're doing, Kevin?
Was just gonna drive home.
There are several warning signs present that you shouldn't be driving.
Like hearing voices?
Like your text-to-emoji ratio?
Oh man, the selfies. Selfie, nailed it.
We all have warning signs that let us know that we're probably not okay to drive. Mine is pretending to be your subconscious.
Craig, come on man, let's split a ride home.
Being a dad is an adventure full of special moments.
A cruise?
Right.
Unexpected moments.
I got this.
And even awkward moments.
Okay, Dad, thank you.
But every moment you spend with your kids, even the smallest moments, can make the biggest impact on your child's life. So take a moment to be a dad today.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. But it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, she's putting them in the same basket. Again. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
Welcome back to Your Need to Know. I'm your host, Catherine Reed. Tonight's subject is Medicare, and I am joined on the show today by Ridge Multop from AARP, who's here to tell us about Medicare, and thank you so much for being here.
Again, thank you very much, Catherine. One of the things I want to talk about, I've mentioned we can talk about Medicaid, but one of the things I want to talk about is the choices. I've laid out a number of different things that require you to make a choice. And you do have time to make these choices. And you do have sources of information. You can go on Medicare.gov. You can create an account. In fact, I will say that signing up for Medicare online is the way to do it. It takes about 15 minutes.
Oh, that's good to know.
And once you have signed up, then you can see their publications about benefits. And every year, at about the beginning of October, Medicare sends out a booklet called My Medicare. And it lists all your benefits that you are eligible for, things you might not be eligible for, and it also lists other options, such as the Part C Medicare Advantage plans in your area, the Medigap plans, which are again private insurers, and how much they cost and what they cover. And so you want to, if you happen to get one of these books, look at it and it helps you make your choices. And every year between early October and early December, and this is why they send the book out in October,
right,
there is what's called open season. And you can change between plans with no penalty during that open season.
So if you chose something last year and you weren't happy with it, or you feel like maybe you need additional coverage in that Part C, then you have a chance during open season to say, I want to change my plan.
Absolutely. Absolutely.
And is that a once-a-year thing? Is it possible
Yes.
to change mid-year, or is there a penalty, or you
No,
can't do it?
You can't do it.
Can't do it. So everybody needs to pay attention to their mailboxes because there are
That's
deadlines
right.
involved.
Exactly. It's usually the second week in December is the
Cut off.
closing date for the open season. And one of the things that people need to remember is that you look at Part C and then you look at Medigap insurance and you're weighing which one do I want. You have to pick one or the other. You don't have to, but if you're going to take one, you have to take one. You can't have both. You can only take one. So that's just kind of, there's some flexibility there, which is good. And there are Part D plans as well that you can choose. So if you've chosen a plan that doesn't have drug coverage for whatever reason, you can look at the Part D drug plans and see if they cover. And again, they have monthly premiums. Don't do it solely by what the monthly premium is. Look and see if the drugs you are taking are covered under the plan you're looking at.
And so does your doctor work with you? Like when you go in, no matter what plan you're under, when you go in, does your doctor know what's covered under drug plans?
Most of them don't, would be my guess. In some cases, yes, but in other cases, no. And they don't know which plans cover which drugs, which is why it gets confusing.
So you have to be a very informed consumer when you go to your doctor to know what plan you have. That seems like a lot for people to know.
It is.
I mean, to have to manage their drugs.
Oh, yes. It is. It's very complicated. Very complicated. No question about it. Now, the next thing I want to talk about is the new Medicare cards. Everyone in Northern Virginia should already have their new Medicare card. They were mailed out between April and the end of June. Why a new Medicare card? Your old Medicare card had your Social Security number on it.
Oh my.
Oh yes.
Oh my.
And I have to tell you, AARP worked for years to get Medicare to issue those new cards without the Social Security number. So you don't have to worry about that. You get it, make sure that you show it to your providers so that they will tell Medicare the correct number which is
You
important.
know, that is so amazing, because do you remember back in Virginia, your driver's license number used to be your social
That's
security number, but
absolutely
that was
right.
years ago.
That's the point.
It's been changed for like
Yes.
2 decades or something.
That's
I
the
can't
point.
believe that Medicare has not done that until now.
That is exactly the point. And then the other thing I want to emphasize is that Medicare won't call you up and ask for your social security number and say, we need you to give us your social security number so you can get a new card, or to make your new card. Those are scams. Those will lead to fraud. So don't take, it's just like, you know, the famous IRS scam.
Right.
Hi, I'm calling from the IRS and we're going to arrest you if you don't send us. You know.
Right.
No, it's the same thing. So I just wanted to be sure that people understood Medicare sends out the cards to the address they have for you, and that's how they do it. And people in Virginia should have them.
Well, it's good to know, and to remind people constantly, you should never give out your social security
Oh,
number
no.
to anybody
No,
over
no,
the
no.
phone.
I always tell people when I'm speaking to an audience, treat your Medicare card like a credit card. You don't just show it to anybody
Right.
or have it laying around. It's
Yeah,
important.
And identity theft.
Yeah.
I mean, one of the keys to identity theft is that social security card
right.
and your birth date.
Oh, yes.
You know, if people have those two pieces of
Absolutely.
information, they've got everything they need to start creating false accounts.
Exactly, exactly. Now, where I want to wrap up, and you can ask as many questions as you want,
Okay.
is what about the future of Medicare? One of the things that you often hear is that Medicare is going broke, Social Security is going broke, blah, 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 you know. Well, in fact, medical expenses and medical charges for medical care and charges for prescription drugs have gone up faster than anticipated. And so even though Part A of Medicare is funded into a trust fund by a payroll tax deduction, the trust fund is going to start running out of money in the 2020s. And so therefore, Congress and the President need to do something to ensure that full hospitalization benefits are going to be paid.
Right.
Because if they don't have the money in the trust fund, they can't pay full benefits. Guess who has to?
Yeah, the
Right?
consumer. Right.
That's exactly right. Now, the other thing is that, of course, Part B doesn't have a trust fund. It's funded 75% out of general treasury funds, in other words, income taxes and other revenues, and 25% with your monthly premium. Your monthly premiums keep going up. If Congress, let's say, were to cut the general revenue going to Part B, your monthly premium could go up even faster. So that leads me to 4 questions for Congress, and for that matter, for candidates for the presidency in 2020. And I'm just going to hold this up very briefly.
Sure.
This is a page from the AARP bulletin, the latest one, about the future of healthcare. And it has 4 questions that you, as a voter, should ask your candidates for Congress. Doesn't matter if they're Republicans or Democrats, but or if they're running as a representative or a senator. Ask them these questions, and their answers will tell you a lot about how they would treat Medicare. Let me just read them to you first.
Absolutely.
Do you believe that Medicare should be cut as a way to reduce the budget deficit?
And the answer should be no.
Because if they do, what happens? Your costs are going to go up. The other thing you can ask them along that line is, do you believe Social Security benefits should be cut to reduce the budget deficit? There are proposals out there to do that. The second question is, do you favor converting Medicare into a voucher program?
Oof.
And you know what a voucher is.
Yes.
It's there's no benefit. They give you a voucher and say, go buy your insurance.
Right.
And if you're over 65,
you won't be able to find it.
You won't be able to find it. If you have a pre-existing condition, you wouldn't be able to find it.
Right.
So ask them.
Yeah.
Do you favor converting Medicare to a voucher system or not? Then the third is, what changes would you make to ensure that people will continue to get promised Medicare benefits? That's the hard question. That's the one that the candidates should be thinking about. If they haven't thought about it already, having people at every one of their events ask them that, saying, what about Medicare benefits? What changes would you make to ensure that people will get the benefits they've been promised already?
And the system that they've paid into, and
the system they've paid into.
You mentioned prior to the
Absolutely.
show, you know, we talk about it as an entitlement program. It's not an entitlement program. People paid into this program.
It's an earned benefit.
So that people have this. And just briefly, just to outline the point at which people need to think about whether or not they're eligible for Medicaid. So if you're
if you have very low income,
right,
that would be for an individual less than $18,000 a year, then you might be eligible for Medicaid depending on your other assets and your other income. The place I suggest calling is the Virginia Insurance Counseling and Assistance Program, which is VICAP.
VICAP, okay.
It is called VICAP. And it is a Virginia state agency that provides this kind of counseling service at no cost. And they will also help you if you have a problem with a provider.
Oh, that's good to know.
Yes, and they can help you apply for Medicaid if you need to.
Yeah, so people who are very low income and maybe they don't own a home, and and they're struggling to get their prescriptions, they're struggling to get their medical care. So VICAP is what people need to know, right?
Exactly.
Well, thank you so much, Ridge. This has been so informative. It really has. I can tell you, before we sat down, I didn't know 90% of this. And I hope, too, that for those of you who are watching today, that this is something you've decided you need to know.